Ladies and gentlemen, thank you for chairperson. It is a great pleasure for me to have an opportunity to present our research results in this meeting. I'm very excited to be here today. I'm Takafumi Morisaki from Japan. I am a clinical engineer at the Chiba Emergency Medical Center. The work I am introducing to you today is from when I was obtaining my degree at Tokyo University of Technology with Assistant Professor Ryosuke Kasai. My study is on how different emotions caused by VRs relate to differences in pain reduction. This is a team. Many people feel pain in their daily lives, and pain is a well-known factor that lowers quality of life. Such pain also causes increase of social loss. Pain can lower one's motivation to do things, such as work, conduct physical activities, and so on. Pain can also be a big stress factor and causes negative influence to many things. Pain can lead to poor relationship, worse mental health, reduced quality of sleep, decrease one's concentration, and so on. So reducing pain is extremely useful to us and the society. At present, the main means to reduce pain is ways which uses painkiller drugs, such as injections, drips, oral intake, patches, and implants. Needless to say, they are very, very effective. But is drug really necessary? Is it the only way to reduce pain? The answer is no. Recent research has found that virtual reality, or VR, can reduce pain, and has received attention as a drug-free pain-reducing method. There are already some VR products in the market which aim to reduce pain, such as devices to reduce chronic pain by showing you a forest, and VR shooting games which reduce pain from burns. However, while the effectiveness has been proved, to date, there are few studies on why VR works through pain and what kind of VR contents are best to effectively reduce pain. Few theories have been proposed regarding beyond VR causing simple distraction. Thus, the purpose of this study was to specify the best VR contents to reduce pain. Searching the relationship between the painless level and the motion caused by each VR content will help specifying what kind of contents does the user really need and would help developing VR contents. Here is the way we approach this. 10 participants served as test subjects for the experiment. For 9 types of VRs, we quantified painless level caused by each VR and also quantified emotion by various axes by watching that VR. We used a device named Pain Vision as a device to quantify pain and used a physiological model, Russell's circumflex model, to quantify the subject's emotion. By using these two values of each VR videos, we looked at the relationship between the painless level and the emotion. Pain Vision is a machine that uses variable pulse current waves to produce pain-like discomfort feelings at the stimulation site. I will call this just pain from now on. The device under the laptop is the machine. By analyzing the current when the participants felt so, we were able to quantify when they sense the current and when they feel pain. Since the degree and feeling of pain varies greatly from person to person, we asked the participants to use minimum sensed current value without using VR as the standard for comparison. By dividing the electric current value when it was felt by the standard, we turned it into a minimum sensing ratio. And by dividing the difference of electric current value when they felt pain and when they sensed it by the standard, we turned it into a current painless ratio. We used these two ratios to quantify pain, to quantify how they felt from the VR. The participants were asked to fill out a questionnaire about what emotions they felt and how strongly they felt them when watching each video. Needless to say, every emotion isn't equal, so we used a two-dimensional model in the field of psychology called Russell's circumflex model to collectively manage these different emotions. In this model, the more to the left, the more uncomfortable the emotion is, and the more to the right, the more comfortable the emotion is. By combining the results of the questionnaire and the coordinates of the emotion in this model, we can express how comfortable the emotions are, and we have defined this as the comfortableness of the VR. By analyzing the quantified sensing, pain, and their comfortableness, we looked at the relationship between the painless level and emotion. 9 different kinds of VR videos were used: relaxing, activities, horror, sightseeing, scuba diving, and so on. The results showed that there was a moderate positive correlation between the minimum sensing rate and the comfortableness. And conversely, there was a negative trend between current painless level and the comfortableness. In summary, the results showed that viewing comfortable VR videos delayed perceiving weak currents that may or may not be felt, but viewing uncomfortable VRs quickened sensing these currents. On the other side, when the current was strong enough to cause pain, the amount of current required to cause pain increased during viewing uncomfortable VR videos, but it didn't increase so much by viewing comfortable VR videos. This suggests that if you want to stop sensing pain itself, comfortable videos may be useful, but if you want to reduce pain, uncomfortable VR videos may be useful. Of course, it's incredible to say, let's look at uncomfortable VRs to reduce pain. But this uncomfortable refers to emotions that are considered so in the Russell's circumflex model. It includes emotions like surprised, nervous, and alerted. So VRs that has surprising things are also counted as uncomfortable VRs. The goal of this project is to understand the relationship between painless level and emotion caused by different VR contexts. In the future, we aim to identify the best VR context for the target pain and for each individual. If the pain-reducing effects of VR are optimized, we may be able to create new options. For example, it is possible that we will be able to use drugs that are less effective but have fewer side effects. So the final users will be everybody that suffers from pain and anticipates VR to be a drug-free pain-reducing technology. Thank you for listening.